Another thing I wanted to touch on is just some basic signs that you are at an increased risk of falling. And these are some early warning signs, but also too, they might kind of come in a little late, but some of these will hopefully give you some good guidance on things to look for if you are trying to be at a less risk of falling. So, weak muscles. If you're somebody who doesn't have a lot of strength to get out of a chair or doesn't have a lot of strength to pick up a small box on the ground, you're at a very increased risk of falling, because if you don't have the strength to do some of those basic activities, you're not going to have the strength to catch yourself. You're not going to have the core strength to be able to change your center of gravity in space very quickly. So weak muscles is a very potent sign that you're at an increased fall risk. Of course, poor balance. This is kind of self-explanatory. I don't really need to go into this too much, but poor balance and fall risk go hand in hand. Dizziness, and this can be from a lot of different things. Maybe it's medication, maybe you can't see very well. I know some of the seniors I work with have vertigo, so basically they just get dizzy if they sit up too fast or if they're standing for too long. That can increase the risk of falling tremendously. If you have any foot or musculoskeletal problems, so foot problems, in specific neuropathy. If you have neuropathy and you can't feel the ground very well, you might not be able to actually detect that, hey, my foot's not even on the ground fully and I'm not gripping it quite as well as I could be. And because of that, you might be at an increased risk of falling. Also, too, with some of these musculoskeletal issues and foot pains, if everything's hurting, you're going to be at a decreased capacity to work out or exercise, or want to work out or exercise, and I should say. And if you are at a decreased basically aptitude to want to work out, that's also going to increase your fall risk as well. So if you're dealing with pain and you're thinking, I'm not going to work out because I'm in pain, that's going to make it much harder for you to overall balance, because the only way we actually improve our balance and get better at our balance is by moving and exercising. And a lot of time when it comes to pain too, moving through those pains to the best of your ability is one of the best ways to actually kind of navigate that as well. Inactivity, we just mentioned this. If you're inactive, that greatly increases the chances of falling. Medications, and this is something that some individuals don't realize. I'm actually taking some medication right now that does make me feel a little dizzy right after I take it, and it just brings to a good point of that there are some medications that you take that maybe make you feel tired or dizzy, and if these are the case for you and you are somebody who's older, maybe you already have poor balance, something that you need to consider, because you are at an increased fall risk for those specific things. And then another thing I wanted to touch on is also memory loss and cognitive issues. If there is not another reason that you should care about your mental health and mental clarity, it's the fact that if you have poor memory or issues thinking, you're at an increased fall risk. And you might be thinking, how does that work? Well, the way this works is that if you can't think properly through different decisions in life, like maybe you're about to go across a busy street, and you're trying to wager, is this safe for me to do? You might do it if you're not thinking quite properly or thinking through properly. You might do it and end up hurting yourself. You might end up falling because it wasn't a good time for you to go out in the street. So that's just one way that kind of the cognition and memory issues can lead to that. And just another, again, reason to take care of your mental health and do the best you can on that regard.